Let's discuss typhoid fever. Typhoid or enteric fever is a common public health problem in Pakistan. It spreads to food. Carriers are responsible for majority of cases of typhoid in Pakistan. So it's a bacterial infection that is caused by Salmonella typhi and Salmonella paratyphi. And we will discuss this session according to following learning objectives. First, we will discuss epidemiology of typhoid fever. What is distribution? What are various determinants? What is incubation period of typhoid? Then we will discuss various clinical features of typhoid fever, various signs and symptoms. Then management. How can we treat the cases of typhoid fever? How can we manage carriers of typhoid fever? How can we prevent typhoid fever? In the end, we will summarize the session. So let's start with epidemiology. Typhoid fever, time, place, person, when it is occurring, where it is occurring, and who is getting the disease. Time. It is more common from July till November in Pakistan. Cases of typhoid are predominant. It is endemic in Pakistan, but there are epidemics of typhoid also. Place, food, where food is served, restaurants, hotels, they are sources. Person like cooks, food handlers, those who handle food. So what is triad of typhoid fever? We can say that agent is Salmonella typhi and paratyphi. This is agent, host, food handlers like waiters, cooks or chefs, environment, hotels. So typhoid spreads through fecal-oral route. It spreads through food. So this is epidemiological triad of typhoid fever. What are the facts about typhoid fever? Globally, there are 21 million cases every year, especially in Southeast Asia and in Africa. And there are 200,000 deaths every year due to typhoid fever, due to complications of typhoid fever. Salmonella typhi is responsible. And the disease may spread through contaminated food. As you can see, food, water, or contact with infected person. They are responsible for spread of typhoid fever. Cause food sanitation is poor in developing world. It is poor in poor countries. And it spreads from carriers which don't have any symptoms. So they are responsible for the spread of typhoid fever. 70% of fever people infected from traveling. There is international traveling. People are traveling from Pakistan to Africa, from Pakistan to Europe. So they are spreading typhoid fever to these countries. The other problem, 3 to 5% of people still carry typhoid bacteria who don't complete the treatment. They may be converted into carriers. Source of infection is case or carrier, predominantly carriers. Where they reside, in gallbladder, there are urinary carriers. There are urinary carriers also. They reside in kidneys. Mode of transmission, you have to remember 5F. What are 5F? Food. It transfers from contaminated food. Flies. Flies are responsible for spread of typhoid fever. Fomites, contaminated clothes, dishes, feces. It spreads through feces. And there is poor sanitation in our country. Fingers, contaminated finger, they are responsible for spread of typhoid. This is a common question that is asked in university. What are 5F of typhoid fever? So these are 5Fs of typhoid fever. Plus, important thing is carrier. Incubation period varies. It may vary from 6 to 30 days. What is incubation period? Period of invasion of organism till appearance of signs and symptoms. It may take 6 days. It may take 30 days. What are major clinical features of typhoid fever? Fever. Fever is predominant in typhoid. There may be vomiting, there may be diarrhea, there may be abdominal pain, abdominal cramps cause GIT is involved. We can describe fever in typhoid. Fever is continuous. What is continuous fever? Fever which subsides only after medication is continuous fever. Onset of fever is gradual. It rises gradually. Or we can say that there is step ladder pattern. Typhoid fever follows step ladder pattern. So there is continuous fever of gradual onset with step ladder pattern, and fever is high grade. Fever rises to 103 or 104 Fahrenheit. There is relative bradycardia. This is not bradycardia actually. With every 1 degree rise in temperature, pulse should rise 10 units. But in case of typhoid, it doesn't rise 10 units. So we can say that there is relative bradycardia. Pulse may be 90, 94, but it should be less than 100. And how we can diagnose typhoid? We can investigate, and gold standard test for diagnosis of typhoid in initial phase is blood culture. This is a common MCQ. So we can diagnose it through blood culture or specific serological tests. With all tests are ELISA. But during second and third week, there should be urine and stool culture. We can do marrow culture. We can do biopsy. We can do clot culture. This can be taken from CSF. Culture can be taken from CSF. So we can say that blood culture, there should be serological tests. CBC should be performed. There is leukopenia in case of typhoid. What is meant by leukopenia? There are low WBCs. Our WBC count is reduced in case of typhoid. We can diagnose fever by leukopenia, and by relative bradycardia. These are the diagnostic signs of typhoid fever. We can perform blood culture, which is gold standard. How we can treat typhoid fever? It is important to treat typhoid fever because it can cause complications. It can cause abdominal distension. It can cause perforation. Person may become carrier. So we should limit the activity. Isolation is gold standard. We should isolate the cases of typhoid. Then we should provide medical care by antibiotics. Ciprofloxacin can be given. Corticosteroids can also be given in case of severe typhoid. Definitely antipyretics like paracetamol should be given. We have to improve the diet. There should be fluid. Electrolyte balance should be maintained. So diet should be increased, and we should provide balanced diet. What antibiotics or which antibiotics can be given? Initially, chloromphenical was given, ampicillin, cotrimoxazole, but there is resistance against these antibiotics. So nowadays, ciprofloxacin is drug of choice, or we can say that ceftriaxone can also be given. And in some cases, azithromycin can be given if a person is resistant to fluoroquinolone. Because resistance from antibiotics is an emerging problem in typhoid fever nowadays. So nowadays we rely on ciprofloxacin, azithromycin, and ceftriaxone. We should give treatment for at least 14 days. Cases should be treated for 14 days, but carriers should be treated for 4 weeks. They can be given ciprofloxacin, but may require alternative drugs. In some cases, like typhoid bacteria resides in gallbladder, cholecystectomy may also be done in chronic carriers. So you have to remember cholecystectomy. How can we prevent? Remember, treatment of cases and carriers. Cases should be treated for 4 to 2 weeks. Carriers should be treated for 4 to 6 weeks. Education. Education regarding hand washing. Food handlers should have a proper hygiene. They should wash their hands. We can prevent typhoid by hand washing, by proper hygiene. Child caregivers, they should also do this practice. Sanitary disposal of feces, as it spreads through feces. So we have to dispose feces properly. There should be proper sanitation. Flies, it spreads through flies, so flies should be controlled. There should be provision of safe water, cause typhoid is a foodborne, typhoid is a waterborne infection. There should be proper safe water supply, hand wash, safe handling of food, proper cooking, proper fomites, typhoid spreads through fomites. So we need to clean the utensils. We need to exclude typhoid carriers. They should not be allowed to handle food. This is the most important thing, that people who are carriers of typhoid shouldn't be allowed to handle food. Like, we need to see cooks. We do stool culture of cooks to see that whether they are carriers of typhoid or not. If they are, we should stop them from handling food, because they are responsible for the spread of typhoid fever. 80 to 90% cases are due to these food handlers. And nowadays, it's a common practice that we are performing stool culture of those people who are handling food, immunization, people who are at risk, travelers, people who are moving to endemic areas, people who are living to endemic areas. They should be immunized, and there should be regular checkup of food handlers. First, we need to investigate them. So we need to check them regularly. And then we can also say that typhoid can be controlled. This is a university question that we need to detect the case and treat. How to detect the case? By blood culture, by CBC, by clinical features. Then we need to give them ciprofloxacin. We need to give them paracetamol. We need to give them proper food. We need to hydrate them. Then disinfection, most important. Then we need to detect and treat carriers. They should be treated with probenicid, ampicillin, ciprofloxacin. Cholecystectomy might be done in carriers. Nephrectomy might be done in carriers, because carriers of typhoid reside in kidneys. And there should be water sanitation. There should be food sanitation. Excreta disposal and flies control. We need to control flies. They are important source of spread of typhoid fever. Immunoprophylaxis, health education. Health education single-handedly can play a very important role in control of typhoid, because food promotion is effective measure, or health promotion is effective measure against typhoid fever, because vaccination provides 50% coverage, although it is given. But most important measure is health promotion. We need to educate people. We need to change the lifestyle. We need to improve our sanitation. Vaccines are given. These vaccines are given like typhoid vaccine. Typhoid vaccine is given at 1, 3, 5, and 7 days. There are 4 doses and a booster dose after every 5 years. Then a single vaccine is given and a booster dose is given after every 2 years. Why after every 2 years? After every 5 years? Because it doesn't provide 100% coverage. We need to mix health education measures. We need to mix health promotion measures with vaccination if we want to control typhoid fever. Like, typhoid vaccine is added in EPI schedule nowadays in Pakistan. It is given at the age of 9 months. At the age of 9 months, this vaccine is given and booster dose is administered to preschool children in order to control typhoid in some cause. Typhoid is prevalent in certain areas of Pakistan, in Sindh, in Punjab, and there are epidemics. Children suffer from typhoid fever. They suffer from complications of typhoid fever. People may die. So we need to control mortality. We need to control morbidity. So we need to give vaccination with health promotion measures. These are the vaccine. First dose given. There is killed vaccine, then there is live vaccine. We can say that there is oral vaccine against typhoid, there is live vaccine against typhoid, there is killed vaccine against typhoid. So you have to remember this. Plus, it is included in EPI schedule. Now we'll summarize. We can summarize this according to levels of prevention. There are 3 levels. There is primary level, there is secondary level of prevention, and there is tertiary level of prevention. We can do health promotion and specific protection. Then early diagnosis and prompt treatment. If a person has typhoid, we need to diagnose it early as possible, and need to treat to stop transmission. And what is secondary level, tertiary level of prevention? Disability limitation. Typhoid may cause disability. And rehabilitation. How will you apply these modes of intervention? Health promotion, food sanitation, water sanitation, lifestyle modification, health education. Typhoid is a waterborne disease. Typhoid is a foodborne disease that is transmitted through fecal-oral route. So we have to reduce the mode of transmission, reduce the transmission. Remember 5F, food, finger, fly, species, fomites. We have to control them. This can be done through health education. We have to improve hygiene. So this is very important measure. Most important measure of controlling typhoid is health promotion. How Europe has eradicated or controlled typhoid fever, and it is still present in Pakistan and in India because they have improved life standard, they have improved living standards, they have improved sanitation, they have improved food sanitation, they have improved water sanitation, they have improved hygiene. Cause Lady Mary in New York spread typhoid and she killed a lot of people. So then they realized that health promotion measures should be taken to control typhoid. This can be achieved through health education. We need to educate our community. We need to educate our people in order to control typhoid because it's a lethal disease in Pakistan. It is causing deaths. Disease is spreading. Then specific protection. Nowadays, there is vaccination against typhoid fever. We need to remember that vaccine is included in EPA schedule. Vaccine can be given after 2 years. Booster dose can be given after 5 years also. There is live vaccine. There is killed vaccine. Who should get vaccinated? School-going children, preschool children, travelers, people who are going to Hajj. Typhoid vaccine is given to everyone who is going for Hajj or Umrah or some other religious duties. They are susceptible people. They should be given this vaccine. They should be prioritized. Then, early diagnosis. Remember blood culture, stool culture, marrow culture, CBC. Typhoid should be diagnosed as early as possible to stop transmission, and there should be prompt treatment. It should be treated because if it is not treated properly, person may develop complications. He may die due to complications. Then there is disability limitation. In case of complication, it should be limited. There should be rehabilitation, social, vocational. Vocational rehabilitation is very important because cooks or food handlers spread this disease. They should be controlled. They should be provided alternative job. So you can remember typhoid by this. Typhoid is a bacterial infection that is caused by Salmonella typhi and Salmonella paratyphi. Fecal route is mode of transmission. Predominantly, it spreads through carriers, so we need to monitor carriers. We need to identify carriers in order to control typhoid fever in Pakistan. We need to identify them. We need to screen them. Then we can say that we can diagnose them. There is a myth. Some people say that Vidal is diagnostic test. No, you should remember blood culture is the ideal diagnostic test for typhoid fever. Person is suffering from fever. There is high grade continuous fever of with step ladder pattern. There is relative bradycardia, WBC leukocytes. Their count is reduced. We can diagnose them by clinical feature and by lab diagnosis. Then we need to treat typhoid. Ciprofloxacin, azithromycin, ceftriaxone sodium. They are ideal antibiotics because there is resistance against chloramphenicol. And then we can give antipyretics. In case of nausea, vomiting, antiemetics, antidiarrheals can be given. Nutrition should be improved, hydration should be improved. We can cope with typhoid by nutrition, by hygiene. Because typhoid fever may last for days, may last for months. We need to improve hygiene of patient. We need to improve hydration of typhoid patient. Then we need to treat carriers also. Then we need to limit the disability. Rehabilitation, vocational rehabilitation is very important in case of typhoid fever. So, by community medicine perspective, management may be asked, or prevention may be asked. So, you need to remember 5 F's: food, fingers, flies, fomites, faces. You can control these 5 F's and you can control typhoid fever. You can do this by health education. We need to educate our people. Education of hygiene, food sanitation. That's how we can control typhoid fever. That's all for typhoid.